This is The Sound of Ideas. I'm Justin Glanville in for Rick Jackson. We'll be right back. Here with The Sound of Ideas from IdeaStream Public Media. I'm Justin Glanville in today for Rick Jackson. Thanks for being with us this hour. Medical experts estimate that nearly 40 million Americans suffer from some sort of hearing loss. That hearing loss can be isolating, damaging to personal relationships, and just plain inconvenient. But addressing hearing loss with a hearing aid has been out of touch to many people because of the high cost of hearing aids. $4,000 or $5,000 in some cases. I was shocked to see that. This past week, however, the Food and Drug Administration took steps to make it easier and maybe less expensive for Americans to get hearing aids by making it possible to buy them over the counter. These changes could take effect as soon as October. We'll spend some time now discussing how this latest move from the FDA will affect those with hearing loss and what barriers remain for people to get the help they need. Dr. Bridget Whitford joins me now. She is the Director of Hearing Services with the Cleveland Hearing and Speech Center. Dr. Whitford, thanks for being with us today.
Thanks so much for having me today, Justin.
And if you'd like to join the conversation, you can call us at 866-578-0903, email us at soi@ideastream.org, or tweet us. We're at Sound of Ideas. You can also text us, by the way, at 216-916-6478. So Dr. Whitford, that number I cited about just the number of people that are affected by hearing loss, 40 million Americans, that's a lot of people. And it's not just the elderly, which might be the picture we have in our head. Who do you see coming through the doors of the Hearing and Speech Center in your work?
It's a huge number of people. It's 15% of the population of adults. It's 3 out of 1,000 children, so it isn't just adults, but it's half of people over the age of 75. And as we're looking at baby boomers, which are such a huge part of the population, it is people who are active, people who are engaged, people who want to remain active and engaged. And so our goal is to make sure that people who want to remain active and engaged stay active in their communities. But it's also people who are vulnerable, people who may be isolated, people who may need some assistance in making sure that they get the help that they need. And so Cleveland Hearing and Speech Center has long time been an advocate for people who may be marginalized. So this Food and Drug Administration rule change, I think the biggest thing that it's going to do is it's going to bring acceptance and talk, and it's going to bring hearing loss into the mainstream.
Yeah, and what are some of the symptoms, the most common symptoms that people come in with? And I ask that not just to kind of explain, but, one of the things we're going to talk about in this segment is that people sometimes are reluctant to go in to get help. What are some of the early warning signs or just the things that you hear people talking about?
Of course, we see the really common, the TV's too loud, the children or the spouse is complaining that we're saying what or ha, not participating as much in activities. That's when it starts to get a little bit more advanced. I'm stopping going to things that I used to enjoy doing. We don't like to see that. Now we're starting to be isolated. Certainly COVID made that a lot worse. Mask wearing, social distancing, people that were relying on visual cues all of a sudden didn't have that with mask wearing. And so people became even more isolated. And so what we don't want to see is people who don't have resources available to them. And so this Food and Drug Administration rule will hopefully bring some awareness. It'll hearing aids or products will be on the shelf and more easily acceptable. We do right now know that the average person waits 7 years from the time they first realize that there might be a problem with their hearing to when they seek out some assistance. So hopefully we will be shortening that amount of time.
We've already got calls coming in, but I want to ask you one more question before we get to those. Hearing loss is something we need to think about, not for obviously the practical reasons, just to make it through the day. You know, you need to be able to hear well in some cases, or especially if you're used to being able to hear well, right? But I've also read that hearing problems can even lead to feelings that you mentioned: isolation, depression, even possibly dementia. I've seen some recent studies. Can you talk a little bit about those kind of ripple effects?
Yeah, there's absolutely. Hearing loss is associated with lots of different health concerns. Dementia is a big one. It's not necessarily a cause and effect. We're not exactly sure of the exact correlation, but dementia is cardiovascular disease, hypertension, safety and balance, fall risks, diabetes. You're twice as likely if you have diabetes to also have hearing loss. And so hearing loss really isn't just in isolation. It affects many other health concerns. And so, you know, it doesn't exist in a vacuum, if you will. And so treating hearing loss has lots of positive effects. The one that I think really speaks to many people is financial. The Hearing Loss Association of America quotes that people who treat their hearing loss make $20,000 more per year than people who don't. So treating your hearing loss, it keeps you active and engaged. You stay employed. You stay engaged in your community, and that's what we want.
Wow.
So, it speaks to your pocketbook, right?
The scope of just what you just spoke to is huge.
Yes.
That's really incredible.
Yeah.
Well, let's get to this first call. This is Linda from Lakewood. Linda, you are on the air.
Hi, I was calling and finding out what services your center provides versus in a hospital center or a hospital setting where they have their own hearing department. What benefits does your center?
Thanks, Linda, so much for that question. We're really pleased at Cleveland Hearing and Speech Center to be able to offer a full range of audiology services. So in addition to hearing testing and hearing aids, we provide all of those services. We provide them for anybody. And so I think that is really what sets us apart. So we accept a variety of insurances that many of other agencies are not able to accept. So Medicaid, Medicare Advantage plans, which have many Medicare Advantage plans people don't realize do have hearing aid benefits, some with zero out-of-pocket for the consumers or low out-of-pocket costs. And we also have our audiology patient assistance program, which is a need-based program, but it does help many people who are kind of the working poor provide hearing aids at a very, very low cost. And we get lots of referrals from the hospital systems and from our competitors for that program. We also have programs for people who are deaf and sign language interpreting, speech therapy, and lots of other things within our agency too.
Thanks for that question, Linda. You know, Dr. Whitford, you were talking before the call about all the reasons that it makes sense to go get help for hearing loss if you can. And I was surprised to learn that only about a fifth of people who do experience hearing loss actually look for help. And I'm guessing one reason, which we'll talk more about, is the expense of particularly hearing aids. But there's also some stigma attached, right, to seeking help for hearing loss.
I think the top two reasons that we hear frequently are stigma and meaning cosmetics. Okay, really, people will notice, people will see it, and then the cost involved. And so this Food and Drug Administration ruling, I think, addresses both of those two issues head on, which makes me very excited about it. So people are talking. I mean, you look at the teenagers right now, they're wearing the AirPods, they're little white things in their ears. They're not too cosmetically appealing when you really look at it, okay? So when I look at hearing aids, they are more cosmetically appealing than the AirPods, okay? And who knows what we're going to get into when we're looking at over-the-counter hearing aids. So that is the wonderful thing about this ruling, is that the free market will do what the free market's going to do. So it's going to take away the red tape, because getting a hearing aid, which was classified as a medical device approved through the FDA, took a lot of time and money for these companies. So it takes away some of that red tape. It's going to allow companies to kind of get in and compete and bring their best product to market, and they're going to be able to do it a little bit more cost effectively, okay? And then they're going to put it out for a price, and then the next guy's going to compete with them and the prices are going to come down. Okay. And so you're going to see innovative ideas at a really nice price point. And hopefully they will also be cool looking, and they will be the thing that people will want to do, because I think that nothing makes somebody look older, and I'm using air quotes here, or more noticeable than not being engaged. Okay.
Right.
So we often see people in our offices when they have stopped participating in things and they're starting to worry, let's say, about dementia. And at that point, now hearing loss is a better option. Okay. And so now they're like hoping that it is just hearing loss and not some of the other things that might be going on. And so hearing loss is very treatable. Put a hearing aid in, and now you can remain engaged and active in your community. And so I'm hoping that people start that process earlier on with this Food and Drug Administration ruling.
And I've read some of the new hearing aids are not even visible when you install them.
Many of them are so tiny, you would really not notice. And they're going to all be, I think, I mean, I don't have a crystal ball, and I don't work for any of them. I have no disclosures to make. I don't work for any of these tech companies or anything, but they're going to be connected to smartphones and to apps, and you're going to be able to, you can stream music. And I'm sure you're going to be able to do all of those things. If you have, your iPhone right now, there's already your health apps and things in them. And so you're going to be very connected, and that's very exciting. Now, all of those are very exciting, of course, for your maybe younger baby boomer person. But when you talk about people maybe that are going to have a harder time accessing some of this technology, if you are 93 years old and you live in a nursing home, you may have a harder time, just going and buying it off the shelf and connecting it to your iPhone. That may not be technology that is appropriate for you. And so there are people that this FDA ruling may not give immediate benefit to, and they may be better served in a more traditional route.
I'm joined this morning by Dr. Bridget Whitford. She is from the Cleveland Hearing and Speech Center. You can join our conversation by calling 866-578-0903 or email us at soi@ideastream.org. Dr. Whitford, let's talk a little bit about the specifics of this FDA policy that's coming down, we expect, in October. So once this happens, someone will be able to walk into a pharmacy, correct, and just find a hearing aid on the shelf and be able to buy it. I mean, how is that all going to work? Typically, you go in, you get your hearing tested, you figure out what kind of hearing aid you may need. Now, folks will just be able to go buy what they think they need. I mean, is that a good idea? How's that all going to work?
It is going to be different. So the ruling is that the hearing aids are designed for people who perceive themselves to have a mild to moderate hearing loss, 18 and over. Okay, but you accurately described it, that they're going to be able to walk into the pharmacy, to the big box store, online, Amazon, wherever the case might be. They're going to be able to get them in a wide variety of distribution models. Okay, and it's their perception of their hearing loss, because the FDA has clearly said that they do not need to start with a hearing test. We at Cleveland Hearing and Speech Center, although we are very enthusiastic about this rule change, the caveat that we have is that we do encourage people to start with a hearing test. The reasons why we believe that to be the case is that, number one, if there is an underlying medical issue, a hearing test would allow an audiologist to be able to pick up on that and make appropriate referrals. Number two, what you perceive as a mild to moderate hearing loss may not be a mild to moderate hearing loss. You might think that's what it is. It may be a more significant. You may have normal hearing. Your perception may not be accurate. So starting with the hearing test will allow you to know if, in fact, your perception of your hearing loss is correct, and if an over-the-counter hearing aid is actually appropriate for you. And then number three, if it is appropriate for you, if you have your hearing test results, you will better be able to fit the over-the-counter hearing aid to your test results. And so that is the reason why we're encouraging people to have a hearing test, regardless if the Food and Drug Administration is not requiring it.
So I go to the pharmacy or I go online and I get my hearing aid. How complex is it going to be for me to figure out how to install that hearing aid correctly? Am I going to need help? Am I going to be able to follow the instruction sheet that comes with it? How is that all going to work?
It's going to be interesting to see what the products, what kind of boils to the top and what the products are. I think that the wording that I've heard used is that a reasonable person should be able to do it. I've seen some samples at some national conventions, and I would say that I was able to do it. Would I feel that maybe my father, and I'm, he would be a baby boomer. Would he be able to do it? I'm not sure that he would independently be able to do it. And he's an older baby boomer. And so I think that depends. I think that depends on the person and their comfort zone. But the idea would be that a reasonable person should easily be able to handle it, I think is the thought. But we all have differing comfort levels with technology and opening the box and digging in and how we're going to connect it to our technologies that we already have, cell phones, et cetera, and such. And so I think some of that remains to be seen.
We just have a couple minutes left. I want to make sure we get to cost. So right now, as I mentioned, thousands of dollars for these hearing aids. Are we expecting that cost to come down? You mentioned competition.
We are expecting costs to come down. That's what we're promised, if you will, in this. I mean, it's kind of the whole idea behind this. I think that also remains to be seen to some extent. Right now, costs can be high. Hearing aids, range from probably about the upper, close to $1,000 each, up to maybe $3,000 each in the Cleveland market. And I have heard that over-the-counter hearing aids could be in the, significantly less than $1,000 each. We haven't seen that yet. Okay, so I think this, again, we'll kind of wait for the free market to do what the free market does, if you will. But that's what we're promised, and I hope that is the case.
All right, last question for you before we close out. Where can folks get help for hearing loss? Obviously, can they just come into your center, drop in, or what would you recommend?
Absolutely. And I want to be very clear that Cleveland Hearing and Speech Center is here to help people, even if they purchase an over-the-counter hearing aid, if they choose that's the right option or not the right option for them. We are here to help them with their journey, and they can contact us. We're online at www.chsc.org. They can call us at 216-231-8787. We have 4 locations. They can stop into any of our locations, but we're here to help them with their journey. And if they purchase something and they need assistance with it, we can help them with that. We also have the more traditional routes of if they want to try, a more traditional hearing aid, we can help with that also.
All right, Dr. Bridget Whitford, thanks so much for being with us today. She's the Director of Hearing Services for the Cleveland Hearing and Speech Center.
Thanks for having me.
Your time.
Thank you.
All right. After this, we will be back to learn about this weekend's One World Festival happening this Sunday in the Cleveland Cultural